Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. I'm glad to report further good news for York Region and for Ontario as a whole with respect to COVID-19. Our wastewater signals have stabilized and are showing a trend towards a decrease. This means that while there are still very high levels of COVID-19 present in our community, and they are still a significant threat to at-risk individuals or the unvaccinated, it is starting to look more and more optimistic as the spring days change to summer. Unfortunately, our hospitals continue to treat high numbers of patients with COVID-19 as well as other severe illnesses, but things are beginning to stabilize in York Region and across Ontario. High vaccination rates in our region, along with many people who've had COVID-19, are helping to turn the tide. We must remember that the protection against infection that is provided by the vaccine or by infection itself wanes over time, usually 3 to 5 months. Fortunately, protection from hospitalization does seem to persist, and according to the most recent evidence, it is fairly robust. However, those who are older or immunocompromised or at risk for other reasons will need the protection of a fourth dose. Please stay up to date with your vaccination as we continue to deal with the current wave and prepare for another one in the fall. Anyone 12 years of age or older should have had a booster or a third dose. Please get yours as soon as possible, even if you've had COVID. Recently, Ontario increased its eligibility for a fourth dose to anyone age 60 or older, and I strongly encourage all eligible residents to book this vaccine, especially those 70 and older. This is available by appointment only and can be booked by visiting york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. You can also walk into any of our York Region Public Health clinics to receive your first, second, or third dose. With York Region's state of emergency recently lifted, Mother's Day this past weekend, and a holiday-long weekend coming near the end of this month, we will be gathering more and more. The weather is also warming up, which allows for outdoor gatherings to become more frequent. Let's continue our approach of taking it outside. This is another way to be safe when seeing our family and friends, particularly those who are older or with other risk factors. These past 2 years have not been easy, and seeing our loved ones and friends is important for our mental health and our social well-being. If you're ill or having any symptoms, do the right thing and stay home so that you don't affect others. Whether it's COVID-19, influenza, or another illness, no one wants to pass on a sickness when you're supposed to be celebrating. If you have access to rapid antigen tests, it's best to test yourself twice, at least 24 hours apart, to minimize the chance of false negatives. Remember to also carry a mask with you, so if you choose not to wear one in most settings, you can still put one on when it seems necessary. This is particularly true in the 3 Cs, when there are crowds, confined spaces, or when you're in close contact with someone who's either immunocompromised, elderly, or just uncomfortable being maskless. Of course, make sure you and everyone you gather with is up to date on their vaccinations. If we all play our part, we can continue to decrease the spread of Omicron and look forward to a safe and more normal summer.